All right, my friends, let's come back together again. If you really can't possibly wait. All right, let's roll through. Starting in the mouth, where are you going next? Into the pharynx, right? Back, we're assuming you're breathing in through your mouth. If you went through your nose, it would go through the nose into the nasal passages, the nasal conchae, into the nasal pharynx, into the back of your oropharynx, right? Okay, then where's it going? Trachea, right? Past the epiglottis, right? Vocal cords would be there in the trachea. Then where? I'm sorry, not the trachea, the larynx. And then into the trachea, my apologies. Down the trachea, which is where we are here, into the bronchioles. And remember that we have this primary, secondary, and tertiary. Primary means 1, secondary means 2, tertiary means 3, right? You're getting less and less large, so I guess small. You're getting smaller as you're progressing downward. And those keep rolling all the way down into this terminal bronchiole. Terminal means the end, right? The end bronchiole, that's where the alveoli are at, these little grape-like sacs. And that's where the actual exchange happens, right? Easy test question, right? Good. Let's talk about the lungs. You've got right and left lungs, of course. They are enclosed by the diaphragm and the thoracic cavity, the thoracic cage. Lots of blood vessels, of course, that are going into these lungs because you're carrying blood from the heart to the lungs. Now, let me say something about your pig. The ductus arteriosus. You remember this? It's different on the pig than it is in humans. Can you tell me what was the point of the ductus arteriosus? Can somebody with a raised hand tell me? Pause. Where was the ductus arteriosus? It connected what two vessels? Pulmonary artery and the aorta. Okay? It was like a bridge between these two. Are you comfortable that in normal pigs or in normal humans, those two vessels are not connected? Are you with me? Because the pulmonary artery is taking blood where? From the heart to the lungs. The aorta is taking blood from the heart to the body, to the brain or to the body, right? So those are two separate circulations. So why does the pig have a connection between those two? And if you were one of the people I talked about this, don't tell me. I'm curious if you know. Why would that be the case in your pig? What kind of pig did we have? A fetal pig. What does that mean? It's a baby. Well, not even quite a baby yet. It's not born yet. So what is a fetal pig not doing? It's not breathing. Right? It is developing, certainly, yeah. It's not fully developed yet. But it's not breathing, right? So its lungs are not being used. So there's no reason to send the blood from the heart to the lungs because there's nothing in the lungs. Right? In our hearts, it does the same thing. We don't connect the pulmonary artery with the aorta. We actually connect between the two atria. There's literally a hole between the two atria that we call the ductus arteriosus that lets blood flow from one side of the heart to the other. Are you comfortable that has to close as soon as you start breathing? Otherwise, there's a bit of an issue there, right? Because remember, one side of our heart's pumping to our lungs, the other side is pumping to our body. So that's what confused me. And some of you, even we were looking at this initially, and I was confused because I know the ductus arteriosus is being in the heart, not attached to the outside of the heart. Does that make sense? Good. All right. So here's that serous membrane I was telling you about, right? Remember the intestines had that outer layer that gives it that lubrication? You have the same thing in the lungs. They call that the pleura, right? This pleural cavity around the lungs that allows it to move. Because it makes sense, right? The lungs all the time are moving in and out, getting bigger, getting smaller, getting bigger, getting smaller. Here's a nice, one more piece. We know the three lobes on the right, the two on the left, and each lobule, each lobe of the lungs is basically its self-contained unit. It has air passages and alveoli and nerves and blood vessels and lymphatic vessels. It's got everything you need. Here's a nice, this is like a CT scan. what the CT scan would look like. It basically slices you into slices, and you can look at it. This is what it looks like. This is going right through mid-thoracic, and here's your right lung. Here's your left lung. There's your heart. And you can see the pericardial cavity, and you saw that on your pigs, that nice thick tissue that was surrounding the heart that you had to open up to see the heart. That's your pericardium. And there's actually a little space between the heart and the pericardium. The same thing for the lungs. Here is the lung tissue. Here is that pleural tissue, that serous membrane on the outside, and there's actually a space in between them to allow this movement. Are we cool? Breathing. We'll run quickly through this. Are you comfortable when you're moving in and out air into the lungs? And that's done via pressure. It's done actually by atmospheric pressure. What your lungs have to do is to decrease the pressure inside the lungs. So that if I have less pressure in the lungs, the air out here can flow inward. How does it do that? By the diaphragm contracting downward. I'll show you a video that talks about this. So as that diaphragm contracts downward, it lowers the pressure in the lungs, which allows the air to push and come in to the lungs. Inside that lung, you've got these little sacs. And are you comfortable that they are sticky together? Like there's fluid, right? In all of our body, there's fluid together. And if we put two membranes together that are stuck with fluid, are you comfortable that they don't want to come apart very easily? Like water has a very high surface tension, right? And of course, much of our body is made of water. So it wants to stick together, right? So we have to have this actual substance called surfactant that lowers the surface tension, that makes it easier for these tissues to come apart and breathe. Babies who are born prematurely can't produce this surfactant. For years, that was one of the main reasons why we had a cutoff. If you were born before X time, you would die. Because your lungs just could not produce this fluid to allow you to breathe. Now we have actually some synthetics that we can use to, if you are born too early, that they can inject this into your lungs and help you to breathe better. It's quite interesting. I mean, it used to be that you were born maybe 7, 8 weeks early. That was about the limit. Now, man, they can even go a couple of months early. It's craziness. How little these little tiny babies, like you can hold it in your palm. It's such a tiny little thing, but yet can still survive. Maybe have difficulties and problems, but can survive. All right, and here's again the surfactant piece is there for you. We will talk more about respiration and expiration, these kind of such things as we go. Respiration is the whole thing. Inspiration would be one specific something. So that's the intake of the air. Expiration would be the outs. Respiration is the whole deal. Okay?